Why would anyone hesitate to roll up their sleeves for a shot that could potentially save their lives? Vaccine hesitancy has a long and storied history, tracing back to the time when vaccines first became part of public health policy. The journey began in the 18th century with the inception of smallpox vaccine by Edward Jenner. Amidst the joy of this medical breakthrough, some people expressed fear and suspicion. The concept of injecting cowpox to prevent smallpox seemed bizarre and nefarious to them. Fast forward to the 19th century, the advent of the Compulsory Vaccination Act in England saw a surge in vaccine hesitancy. People protested against this law, citing personal liberty and mistrust in vaccine safety. The resistance led to the formation of the Anti-Vaccination League in 1853 and later the Anti-Compulsory Vaccination League in 1867. In the 20th century, the polio vaccine brought a fresh wave of vaccine hesitancy. Despite the crippling effect of polio and the Qatar incidents of 1955, where a batch of live polio vaccine was accidentally administered to patients, boosted doubts and fears about vaccine safety. Fast forward to the 21st century. The digital age has amplified vaccine hesitancy. The ease of information dissemination has allowed conspiracy theories and misinformation to spread like wildfire. The infamous MMR autism-linked controversy, despite being thoroughly debunked, continues to fuel fears about vaccine safety. In the face of global health crises like the COVID-19 pandemic, vaccine hesitancy poses a significant threat. The anti-vaccine movement, fueled by misinformation, mistrust, and conspiracy theories, has grown in strength and numbers, challenging global vaccination efforts. The sole purpose of this video is to raise awareness about global health issues affecting diverse communities. If you're new to this channel, please like, subscribe, and hit the notification bell to stay informed. Reflect for a moment. How different would our world look today if there was hesitancy in using the smallpox vaccine? The chronicles of history are packed with accounts of how vaccines have drastically improved our world. Yet, why does vaccine hesitancy still exist in this era of limitless information? Vaccine hesitancy is defined as the delay in acceptance or refusal of vaccines despite their availability and supporting evidence. It is a multifaceted issue arising from a complex interplay of factors including misinformation, complacency, convenience, confidence or trust, socio-demographic context, structural factors like health inequalities, socio-economic disadvantages, systemic racism and barriers to access. Globally, surveys conducted in 2021 indicated that between 50% and 60% of respondents worldwide were willing to receive the COVID-19 vaccine, with significant variations across countries. In the UK, the willingness to be vaccinated varies among ethnic groups. The World Health Organization has classified it as one of the top 10 threats of global health. According to the World Health Organization, vaccines prevent 2 to 3 million deaths globally each year. Yet, there are around 1.5 million deaths annually that could be averted if global vaccine coverage heightens. Now, let's dive deeper into the facts. A study conducted in 2023 revealed that 1 in 5 people globally express some level of hesitancy towards vaccines. That's more than 1.5 billion individuals. Specifically in the United States, about 20% of the population reported being hesitant to getting vaccinated. Now let's imagine a world where vaccine hesitancy reigns. Diseases that were once on the brink of extinction like measles and polio would make a devastating comeback. Society as we know it would be under constant threat, with frequent disease outbreaks disrupting our lives and communities. But why are people hesitant? There are various reasons. Some point to the lack of trust in pharmaceutical companies or the speed at which vaccines have been developed. Others express concerns about potential side effects. Despite these fears, it is essential to remember that the benefits of vaccination far outweigh the risks. Each vaccine undergoes rigorous testing before it is approved for public use. This includes extensive clinical trials involving thousands of participants to ensure its safety and efficacy. Once a vaccine is in use, it continues to be monitored for any adverse effects. Moreover, vaccines have a long track record of success. They have eradicated smallpox, nearly eliminated polio, and drastically reduced the number of cases of diseases like measles and whooping cough. They have saved countless lives and prevented immeasurable suffering. But the fight is not over. Vaccine hesitancy threatens to undermine these achievements. It is up to each and every one of us to do our part. So what can you do? Educate yourself about vaccines. Understand the science behind them. Speak to your healthcare provider. They can provide you with accurate, reliable information about vaccines and answer any questions you may have. Remember, every person who gets vaccinated not only protects themselves, but also helps protect others, particularly those who can't get vaccinated due to medical reasons. Vaccination is not just a personal decision, it is a social responsibility. So don't let hesitancy stand in your way. Trust in the power of vaccines. So roll up your sleeves and get vaccinated. It is the best shot you have at a healthier future. While vaccines have indeed saved countless lives and our strongest tool in fighting off deadly diseases, it is important to acknowledge the instances where things didn't go as planned. There have been rare occasions where vaccines have caused adverse effects. Take for example the Qatar incident in 1955, where a polio vaccine ended up causing 40,000 cases of polio instead of preventing it. Or in 1976 swine flu vaccination campaign, which was associated with increased risk of developing the neurologic disorder Guillain-Barré syndrome. These instances have contributed to vaccine hesitancy and have fueled the fears of those skeptical about vaccination. It is crucial to understand that these are rare exceptions and not the norm. In almost all cases, vaccines are safe and effective. These instances, while unfortunate, are extremely rare. The benefits of vaccination far outweigh the risks. It is a matter of weighing the potential risks of a rare adverse event against the very real risk of contracting a potentially deadly disease. We must remember that vaccines have eradicated diseases like smallpox and drastically reduced the incidence of diseases like measles and polio. Let's not let the exception cloud our judgment of the rule. Thank you for watching. I hope you learned something new today. Until we meet again, this is Street Science with Dr. Kum. One story, one street at a time.